County, it's Cassandra, and I'm here with my 1080 Brittany, and today we're going to be talking more about 911 education.
Due to COVID, we're going to be masking up and social distancing. Our partner, Dispatcher Selena, will be checking in from the dispatch center as well today. So, what are we going to talk about, Cass?
Well, Brittany, did you know that 911 dispatchers have a protocol called Emergency Medical Dispatch, or EMD? They use this to ask questions and give instructions during a medical emergency. This protocol ensures that all calls are professionally handled with the same level of quality and care.
All Lyon County 911 dispatchers are certified to use EMD life-saving instructions. But do you know how we decide what instructions to give you during an emergency?
EMD protocols are a specific set of step-by-step instructions to get the right medical help to you fast. Dispatchers begin by asking the most important question: what is the address of the emergency? By knowing the address, it can save valuable time getting an ambulance to your medical emergency. We also have to verify your location and phone number by asking a second time and having you repeat it back to us. This ensures that we are sending help to the right location and we can call you back if we get disconnected. While we are asking the medical questions, our partner is dispatching an ambulance to your emergency. It is important to stay calm and answer all the questions to the best of your knowledge. This will help the EMS responders prepare for your specific emergency.
After verifying your location and phone number, the next question you'll be asked is, tell me exactly what happened. Remember, we cannot see your emergency, so be sure to provide as much information as you can.
We know that it can be difficult to stay calm during an emergency. Staying calm does help us get the best information from you as quickly as possible. The more information you can give us, the better we can narrow down the instructions to give you before responders arrive to your location.
Some important questions that the dispatchers may ask you is, are you with the patient now? How many people are hurt or sick? How old are they? Are they awake? And are they breathing? If the patient is not awake, we may ask you to verify the patient's breathing status. This is called determining agonal breathing. We begin this by saying, okay, I want you to say now every single time she or he takes a breath in, starting immediately. If it is 8 seconds or more between breaths, it is considered to be agonal. If the patient is in agonal breathing, CPR instructions will be started. Every detail is important so that we can give you the correct help and instructions.
After questioning, the dispatcher will provide post-dispatch instructions, or better known as PDIs. By saying, I'm sending the paramedics to help you now, stay on the line and I'll tell you exactly what to do next. PDIs provide specific care instructions to the patient, such as how to control bleeding, how to control or flush a burn, or even administer aspirin in case of a heart attack.
The dispatcher will then start their case exit instructions, depending on first or second party callers and the severity of the call. We will stay on the line and continue to gather updated patient information until EMS arrives.
Lyon County 911, what is the address of your emergency?
Yes, you do dispatch.
Can you repeat that for verification, please?
624 10 community contact.
Okay, and what is the phone number you're calling from? Tell me exactly what happened. Okay, are you with the patient now? How old is she?
52 is rolling up and we'll be headed out of here.
Is she awake? Okay, is she breathing?
309 137.
Dispatchers will then choose from a list of medical call natures to ask you specific questions that are designed for that medical emergency and possibly give you life-saving instructions. These may include allergies, animal bites, assaults, explosions, cardiac arrest, choking, seizures, diabetic problems, electrocution, overdoses, pregnancy, gunshot and stabbings, traffic accidents, and many, many others.
Lyon County dispatchers have to be prepared for any of these types of emergencies at all times. All 911 dispatchers are certified basic life support providers for CPR and AED. Do you know how to do CPR? Do you know how to do the Heimlich maneuver? And do you know how to use an AED?
Choking is one of the EMD call natures. All dispatchers are certified to give the Heimlich instructions, which may progress to having to do CPR or use an AED.
If choking is determined to be the chief complainant or the most urgent condition during an emergency call, we will ask you questions such as if the patient is alert, if they are breathing normally, are they able to talk, and what are they choking on? If the patient is unconscious, we will start the CPR process. Lyon County dispatchers are prepared for other emergencies, such as childbirth. Can you imagine being in labor and knowing that it may take responders more than 20 minutes to reach you, depending on your location?
While my partner is dispatching EMS responders to your emergency, I can begin childbirth instructions. These instructions include preparing the mother, getting supplies, and step-by-step instructions for a safe delivery.
As the baby delivers, support the baby's head and shoulders and hold its hips and legs firmly. Remember, the baby will be slippery, so don't drop it. Is the baby completely out now? Good. Keep the baby between the mother's legs and level with her bottom. Is the baby crying or breathing? Good. Gently wipe off the baby's mouth and nose. Dry the baby off with a clean towel, then wrap the baby in another clean or dry towel. Cover the baby's head, but not its face. Without pulling the cord, put the baby down between the mother's legs, level with her bottom. Be sure the cord is not wrapped around the baby's neck. Be sure to keep the baby and the mother warm.
Lyon County dispatchers are prepared for virtually any emergency by using EMD protocols. We can give you life-saving instructions and even keep you safe until help can arrive.
On the next episode of 911 Education, we will show you what a day in the life looks like, from our crazy schedules to the emergency calls, and how we train 911 dispatchers. Until then,
We're
10-7. God, what's that awful?
Finding Nemo.
Yes.
Story. Can you help us? I'm sending the paramedics now.
Oh my God.
Stay on the line.